So my name is Carlene and I'm doing this video for Health Union. I am a hepatitis-C advocate and the subject of stigma comes up a lot. And who should we share our diagnosis of hepatitis-C with? And I'm pretty passionate about allowing the patient who has received this diagnosis to make that decision on their own. I think it's a personal decision. I myself, whenever I found out, initially, I didn't tell anybody for 2 or 3 years. I didn't tell my church. I didn't tell my parents. I didn't tell my family. I did tell my husband, and my children were young, and so they couldn't really understand. But I immediately told my husband from the very beginning, but that was it. And he was enough. He was enough of a support for me, and so I'm really thankful to have had him. And now, after several years and complications and a lot of problems with hepatitis C, my husband decided to start a foundation kind of on my behalf whenever we hit some roadblocks. And so the cat was out of the bag, and it's not every day that your husband wakes up and wants to change the world. And so I really had to bite my tongue regarding my own shame and kind of embarrassment about hepatitis C, and I did, because he was so excited about this nonprofit and this charity that he wanted to start. We were really frustrated. We got a lot of bad information, no resources whenever we were kind of going through the initial stages of being diagnosed and then looking for treatment and information. And so it was a gradual coming out. My husband was excited and started raising awareness, climbing mountains, and a couple of my sons got on board, and then my daughter, and I was reluctant. I kind of came along last, and then whenever I did come out and share my diagnosis, I came out all the way, and I posted it on Facebook, and now I'm a full-fledged advocate. And I think if you were to Google my name, hepatitis C would come up right beside it. And so I've done a lot of interviews and talked a lot about it openly and publicly. But even after I started talking about it, I didn't talk a lot about the details of how I contracted the disease, and it was through drug use. And so whenever I was a teenager, I did have a transfusion, and so I shared that with people, but that's all I shared. And I didn't share the fact that I was transfused because I was expecting and living on the streets of Houston, and I did mushrooms one night. So I was also an IV drug user, and that information has just, I've been able to come out with it slowly as I felt like it was helpful to people. I committed to never talk about my past unless I did feel like it was helpful. But so I have been on every side of the spectrum, from not telling anyone to just, really blasting it all over the internet, including my mode of transmission, which is not something that I shared for years and years, and had even committed not to share unless I felt like it could be helpful. So I really feel for both sides. I believe there really is a stigma, and that if you tell people, you really might be shunned, and you really might even get bad service at, I don't know, at your hairdressers or at a restaurant, or with even providers, are ignorant about it. A lot of nurses don't have information about hepatitis C, so that is real, and that is something to consider. And then there are people who don't care about what people say or think, and I admire them so much. I'm not one of them. But I think it's a really personal choice, and I admire both sides. People that choose to keep it a secret, people that choose to only share with just a select few, people that are way out in the open. And I have a girlfriend who carries a purse around with, the big red ribbon. Her name is Pam, as well as she puts magnets on the side of her car that says, "Ask me about hep-C." And she's just a beautiful, wonderful, outspoken advocate, saving lives. So, and yet I understand that the stigma is real and that the discrimination is real. And so I think it's a really personal choice. And I don't judge people either way, and I don't think that anybody should, because you don't know what kind of support or lack of support people have, and it's a process for a lot of people, as it was for me. It took me years and years to kind of come out all the way and share everything that there was to share about my transmission, mode of transmission, and diagnosis, and all of those things. Now I'm completely happy with the fact that we did do that. It was my husband really that kind of egged me on, and I'm very thankful for him. However, I don't regret that I didn't tell anybody for years. And one of the reasons I didn't tell people is just because I was, I didn't want to be disappointed in their responses. I knew that people would probably as low as my expectations could go regarding people's response, I felt like people would probably exceed my low expectations and behave even poorer than my lowest expectation whenever I shared that diagnosis, and I just didn't want to be hurt. And so that was really one of the main reasons. It wasn't even necessarily shame as much as it was just I didn't have a lot of confidence in the way people would react. And sure enough, people have some of them have reacted really well and some not. In even close family members, I know a very close family member changed the subject and said, I could never find my keys in this apartment right after I told them. And it was just so hurtful because it was just a way of basically saying, I do not want to acknowledge this or talk about this. I'm ashamed of you and the behavior that must have, brought this diagnosis on or whatever. And so it's a really personal decision, and stigma is real. So take your time. You don't have to tell anybody until you're completely ready to do so. You could wait a year, you could wait 6 months, you could wait 4 days, but it's really a personal decision.